Today, we're diving into a condition that can start with just a simple cramp, but can end with a really, really tough choice. It's this whole journey, from a hidden threat deep inside the body, all the way to this high-stakes mission of saving a limb. So let's get right into it.
You know that feeling, right? That deep ache or cramp you get in your calf when you've been walking for a bit? You probably just chalk it up to a muscle ache. But what if that predictable pain, the one that always seems to show up after a block or two, and then just vanishes when you rest? What if that isn't a muscle issue at all? What if it's actually a distress signal, a warning flare coming from your arteries telling you that a silent crisis is unfolding deep inside?
And believe me, that warning sign is anything but an isolated event. We're talking about a massive global health issue. The number is just staggering. It's a condition called peripheral artery disease, or PAD for short, and it affects more than 200 million people around the world. So that seemingly simple leg cramp, it's actually the local symptom of a huge, widespread problem.
All right, so let's put a name to the most severe form of this condition, the point where the limb itself is really at risk. Okay, here it is, chronic limb ischemia, or CLI. The best way to think about it is like a critical supply and demand crisis happening in your leg. Your muscles and tissues are practically screaming for oxygen-rich blood to do their job, but the supply line, your arteries, is so narrowed that it just can't deliver. And the result? Well, it's pain, tissue damage, and a limb that's in serious jeopardy. So to really get how this all happens, we need to zoom in. I mean, way in. We're going right inside the arteries themselves to see where this whole crisis actually begins. It all comes down to the slow-burning process called atherosclerosis. Okay, so here's how it plays out, step by step. First, something damages the smooth inner lining of an artery. Think of it like a tiny crack in a pipe. The body's immune system, trying to help, rushes to the scene, but this causes inflammation. Now, this creates a sort of sticky patch, and that's where cholesterol and other gunk starts to get trapped. Over time, this buildup forms what we call a plaque. That plaque can just keep growing and growing until it narrows the artery, that's stenosis, or, even worse, it can rupture, triggering a blood clot to form, and that's a thrombosis. And this visual gives us the absolute perfect analogy. Atherosclerosis is basically like rust slowly building up in your body's plumbing. You can see the whole progression right here, from a nice, healthy, open artery all the way to one with this complicated lesion that's almost completely blocked off. And you know the really scary part? It's a silent process. This can be happening for decades without you even knowing it. So what exactly accelerates this rusting process? Well, some of these things are things we can actually do something about. We call them modifiable risks. We're talking about smoking, diabetes, high blood pressure, all things that really damage that delicate artery lining. And then, of course, there are the factors we just can't change, like getting older or our genetics. But here's the key thing to remember. These risks don't just add up. They multiply. They work together to dramatically speed up that whole silent process. Okay, so you've got this silent process happening in the background. How in the world do doctors start to crack the case and figure out what's really going on? Honestly, it's like a fantastic piece of clinical detective work. And the investigation? It often starts with some really simple, old-school techniques right at the bedside. No fancy equipment needed. First, a doctor will check for pulses at key spots in the leg and foot. A weak pulse or no pulse at all? That's a huge clue. They might also do something called Berger's test. You just lift the leg up, and if it turns really pale and then gets all reddish when you lower it back down, well, that's a simple visual sign that the blood flow is really struggling to fight against gravity. But the real cornerstone of diagnosis, the key clue, comes down to a surprisingly simple and elegant number. It's called the ankle brachial index, or ABI, and all it really is a comparison of the blood pressure at your ankle to the blood pressure in your arm. That's it. And this chart really shows you why that simple ratio is so incredibly powerful. See, in a healthy person, the pressure in the ankle and the arm should be about the same, which gives you a score of 1.0 or even a little higher. But as those arteries start to rust and narrow, the pressure down at the ankles starts to drop. Once that score dips below 0.9, that confirms the diagnosis of PAD. And then look at this red zone here. If you get a score below 0.4, that's a sign of severe ischemia. Now we're talking about the limb itself being in real danger. Yeah, that low score, it signals a critical turning point. This is the moment the condition goes from something you manage over time to a true emergency. We are officially entering the red zone. Now, doctors use these classification systems to get really specific about the severity. But you don't need to memorize all the stages and names. Here's the crucial insight, the big tipping point. It's the moment the pain shifts from happening only when you're active to happening even when you're at rest. That change right there, or the first sign of a sore that just won't heal, that's the alarm bell. That's the signal that we've crossed over from a chronic problem to an immediate threat to the limb. And tissue loss isn't just some abstract medical term. This is what it looks like in the real world. This is what happens when the lack of blood flow gets so severe that the skin and the tissues underneath literally start to die. This leads to ulcers, to gangrene, and this, right here, is a full-blown medical emergency. Now, what happens if one of those plaques ruptures and a clot suddenly blocks off an artery completely? That triggers something called acute limb ischemia. And doctors have a classic way to remember the warning signs. They call it the 6 Ps. First, there's sudden severe pain. Then the limb becomes pale, almost marble white. The pulse, it's gone. Then you might feel paresthesia, that awful pins and needles numbness. In the worst cases, paralysis can start to set in. And finally, the limb gets cold, a sign doctors call poikilothermia. If you experience any of these, it's a sign to get to an emergency room. I mean, right now. Okay, but this isn't just a story about a problem. It's absolutely also a story about solutions. Because at this point, the goal is crystal clear, and it's urgent. We have got to restore the flow. For a lot of patients, the battle starts with what we call conservative management, and this is the foundation for everything. It begins with tackling those risk factors head-on, and stopping smoking is absolutely non-negotiable. The next big tool is supervised exercise therapy. And this part is fascinating. Walking actually encourages your body to grow brand new, tiny blood vessels. It basically creates its own natural bypasses around the blockages. And finally, there are medications that can help stabilize those plaques and just keep the blood flowing as smoothly as it can. But what happens when all of that isn't enough? Well, that's when doctors turn to 2 main philosophies to get that blood flowing again. You can think of it like this. There's the plumbing approach, which is all about clearing out the existing pipe. And then there's the detour approach, where you basically build a brand new road to get around the traffic jam. And right here, you can see those 2 philosophies in action. Over on the left, that's the plumbing approach. These are endovascular techniques, where doctors go inside the artery with things like a tiny balloon to widen it, or they place a small mesh tube called a stent to prop it open. Then on the right, you have the detour approach. This is open surgery, where a surgeon creates a whole new path for the blood using a graft, which can be a spare vein from your own body or a synthetic tube to bypass that blockage completely. So we've taken this whole journey, haven't we? From a simple leg cramp deep down inside the arteries, through all the detective work of diagnosis, and even into the operating room. But the single most important factor in this entire story, it really comes down to just one thing. This chart, this clinical algorithm, it basically maps out the entire journey we've just talked about. It all starts with a patient complaining of leg pain. Then, that key ABI test acts like a traffic cop. If the score is pretty good, you head down the path of conservative therapy. But if that score is low, if it points to pain at rest or tissue loss, then the path leads urgently towards getting detailed pictures and ultimately restoring the blood flow. You see? Every single decision is driven by how severe the problem is and by the ticking clock. And that brings us to the most crucial takeaway of all. It's a phrase you'll hear vascular surgeons say over and over again: time is tissue. It's that simple. The longer a limb is starved of blood, the more of its tissue dies. So early detection, getting aggressive about those risk factors, and getting the right intervention at the right time, these aren't just best practices. They are the only way to prevent irreversible damage and ultimately to save the limb. So we want to leave you with this final thought. You now know the warning signs, you understand the silent process that causes all of this, and you know that the health of your body's internal plumbing is really built on thousands of small daily choices. So the question is, what's one choice you can make for your arteries today?